Hello. Your eye care team may recommend that you have a YAG Laser peripheral iridotomy, sometimes abbreviated to PI or LPI. This is because you may have narrow angles at the front of your eye. In healthy eyes, the fluid inside the eye circulates constantly. It leaves the eye through tiny drainage channels in the small gap between the front of the eye and the iris, known as the angle. A PI uses a laser light beam to painlessly create a small hole in your iris. This helps with the normal circulation of the fluid, preventing the angle from closing and the eye pressure rising. It is rare to have any complications. However, as with any procedure, there are potential risks, including temporary rise in eye pressure, inflammation inside the eye. These can usually be treated with eye drops. You may also experience ghosting, shadows, glare, and lines in vision, but these normally fade over time. Bleeding inside the front of the eye can cause misty vision. This will usually resolve after 24 hours. A loss of vision, or the need for urgent surgery following the procedure, is extremely rare, around 1 in 5,000. If you develop frequent misty vision or pain in the eye, please contact the eye department or an on-call eye doctor if it is out of hours. Surgical lens extraction is a procedure that is identical to cataract surgery. It is a treatment for angle closure, as it frees up more space in the eye to open the angle. You may not require treatment if you have narrow angles that are unlikely to raise the pressure in your eye. However, if your eye pressure is high, or you're at risk of acute glaucoma, where a sudden rise in pressure occurs, you will be advised to have a procedure. This is to protect you from losing sight. Remember, laser treatment will not restore any sight you may have already lost. Even with successful laser PI, you may still need eye drops and other medicines to successfully treat any glaucoma. If you decide not to have a PI or lens extraction, you may be at risk of developing acute glaucoma. This could also worsen your long-term angle closure glaucoma, resulting in high pressure and loss of vision. Please discuss the risks and benefits with your eye specialist. On the day of the laser treatment, a member of the eye care team will explain the procedure to you. You'll be asked to give your consent for the treatment. Your vision will then be checked and you'll be given eye drops to make your pupils small. An anesthetic drop will then be given to numb the eye before a special contact lens is placed onto it. You may also be given some eye drops before or after the procedure to help lower the pressure in the eye. The laser makes a clicking noise, and you may be aware of bright lights and colours. You may experience slight discomfort, but this is usually mild and lasts for a short time. The laser treatment usually takes 5 to 10 minutes per eye. After the treatment, you'll be asked to wait 45 to 60 minutes so that the team can check your pressure. You will be given eye drops to use at home for a few weeks after the laser procedure. Do not drive for 24 hours following the treatment. You will need to return to the clinic after a few weeks. This is to check that your eye pressure is stable and your angle has opened up. Ask your eye specialist about local accessible support groups. For example, you could contact Glaucoma UK to find out what support is available. They are a fantastic charity offering support and advice for people living with glaucoma.